Okay, everyone, I think we'll get started. Again, thank you so much for joining this webinar. Just so you know, this is being recorded and we will post it on the Hoban website in case we reach a capacity where Zoom kicks somebody off. You'll be able to see that recording as well. I just wanted to thank Hoban for allowing me to provide this talk, and a special thanks to Dr. Curry for being here, and for Melanie White, who helped set all of this up, and I really appreciate their help. Just to give you some background on me, for those that don't know me, I am an 87 Hoban graduate, and I went to medical school at NeoUCOM, now that's called NeoMed. I did my training at Akron General, and I finished an emergency medicine residency there and earned my board certification in emergency medicine in '97. I currently work for a national emergency medicine company called US Acute Care Solutions. Our company staffs over 220 emergency departments across the country. We see so many different hotspots going on with this crisis. Our company normally sees over 6 million patients per year. So that gives us a lot of information, a lot of ability to learn more about what's going on throughout the country and learn best how to fight through this pandemic. Locally, I work for Summa Health System. I see patients in all 5 of Summa's emergency departments, and I'm the director of quality at Akron City. But most of all, I wanted to just thank you so much for taking the time to listen today. This is a very real pandemic, and I'm seeing it firsthand. I'm seeing firsthand how ill this disease is making some people. I'm also concerned that there's just a lot of misinformation on social media. And so today I hope to provide you with some truth based on what I'm seeing on my own personal experience on a day-to-day basis. So what will our agenda be today? We're going to go over a few things fairly quickly. I'm going to talk about what is COVID-19, give some numbers and projections, and what it's like to see patients. Also, we're going to go over about things that you can do. I expect all that to take about 15 minutes, and then we'll like to spend most of our time using the rest of our hour together just to answer your questions. There's a chat button that should be on the bottom of your screen on Zoom, on the platform, on the Zoom platform, and you can use that chat button to send me questions. You can type them into everyone. They may have the same question, or you can type them into me. I'm also using, thankfully, my daughter Alexia. So if you see her name on there, you can directly chat to Alexia, and she's going to help me kind of review these questions in case I miss them. So what is coronavirus? This pandemic is being caused by the newest coronavirus, which is about the 7th major coronavirus. It's a cousin of SARS, which stands for Severe Acute Respiratory Syndrome, that we first saw in China in 2003. And it's also a cousin of MERS, which is Middle Eastern Respiratory Syndrome, which we saw around 2012. Both of those illnesses were also caused by a coronavirus. This is called COVID-19, and that really comes from just the word coronavirus disease in the year 2019 that we first noted this disease. It's a respiratory tract infection. The infection, it causes fever, coughing, and shortness of breath. You can see in my image there, that's an image of the respiratory tract. The upper respiratory tract, which is really the mouth and nose and sinuses, anything above the voice box, or the lower respiratory tract, which is the lungs and the windpipe, more below the voice box. This virus its main effect is on the lungs. Its main effect is causing low oxygen in very sick people. So COVID-19 lives in the lungs in humans, and this is why it's spread by droplets. It's spread by cough, breathing, sneezing, and it's respiratory droplets that are our biggest concern. Both people with and without symptoms can transmit this disease. This is really one of the most important things we need to know when we're talking about how to prevent the spread of this disease. So where are we seeing it? This map is from John Hopkins website. You can see the web address there. And this map tells us that these red areas, these are hotspots. And we've read about them in the news. It's mainly the big cities, especially in New York, especially in Detroit, especially in New Orleans. But the US does now have the most confirmed cases of any country in the world. I did just update these numbers yesterday. So worldwide, we've seen about 1.8 million cases, and in the United States, almost 560,000 cases. Drilling down here to Ohio, you can see it's over 6,200, and in Summit County, our latest numbers were about 250 to 260 cases. Now, it's worthwhile to know that these are patients that have been tested and have tested positive. However, we know that there's many, many more cases that are positive that we are not testing. For example, to maximize our resources of what tests we have available to us, we use the tests where they are most needed. We don't currently test every emergency department patient. If you're well enough to go home, we instruct you on self-quarantine for 14 days. And we look to use our tests for only our high-risk populations, the people that we are admitting to the hospital, the people that are very sick, or people in a high-risk population such as the nursing home population. I did read this morning there was about 65,000 tests done in Ohio so far. So we're just close to 10% positive testing rate in Ohio. But we know that these numbers aren't all of the cases. We know that there's more cases coming each and every day. I would tell you that about 85% of cases of COVID-19 are really mild to moderate disease, bad cold, sometimes, like we've talked about, even without significant symptoms. It's about 15% of people that have this disease that are hospitalized, and about 5% that are critically ill, needing the intensive care unit. You've heard the term that we must flatten the curve. I wanted to explain this a little bit further. It means not only to decrease the number of cases by slowing down the spread of the disease, therefore we decrease the number of deaths due to this disease, but it's also meant to not overwhelm the capacity of the healthcare system. We don't want to run out of hospital beds or ICU beds. We don't want to run out of ventilators that we need for our sickest patients. So how do we flatten the curve? We know that one of the most important things is simply hand washing. We need to do that more frequently. And I wash my hands darn near over 100 times a day now due to my work. One thing that we'll keep emphasizing is to not touch our face. We do touch objects that can be concerning for contamination, and then touching our face, getting into that respiratory tract that we just showed, is what's the biggest concern about spreading the disease. Cough in our elbow, sneeze in our elbow. When we sneeze into a tissue, throw that tissue away right away. And disinfecting our surfaces. We're doing much more of that, not only in the hospital, but we are doing it more at home, and we should all be doing that as much as possible. Most importantly, it's social distancing, and you've heard this term so many times. We do know that for sure, the better the public compliance with social distancing will flatten the curve. Most importantly, by social distancing, we're not just protecting ourselves, but we're protecting our loved ones. We're protecting the people that are our elderly friends that could get very ill from this disease. But not only are these measures helping saving the public health, but truthfully, you're helping our workforce in the hospitals. You're helping us not to get sick ourselves so we can be there for all of our patients. So I do thank you for what you're doing, because what you're doing is helping me. If you are sick, the most important thing is to stay home. The most important thing is to self-quarantine in your own room, away from your family even. How has the closures and social distancing helped Ohio? This couple of pictures I put in this slide were information or data from the Institute for Health Metrics. Their website is covid19.healthdata.org. And what it does is it projects the use of hospital resources, how many hospital beds or hospital admissions we we need, how many ICU beds and ventilators we need. The picture on the left was a projection from late March. It projected that on our peak day, on our worst day of utilizing resources, that we anticipated over 8,000 hospital admissions in Ohio with over 1,300 patients being in the ICU. And the biggest concern at that time was that we, based on our estimates, thought that we would run out of ICU beds. That picture there shows that we would have had an 81 bed ICU shortage. Those are very sick people, and not having the right care was very worrisome. You can see the picture on the right is really thanks to social distancing and all that we've been doing. The picture on the right is a projection from late last week. That purple line is the number of hospital admissions, and you can see that our projection now is much less. Opens up our beds for other non-COVID-19 patients. We're still seeing patients every day with heart attacks, pneumonia, broken ankles. We still need to take care of all those patients, and not having the hospital system overwhelmed is what was very important to getting through this. What we are doing is very difficult, but the bottom line is we are saving lives by what we're doing with social distancing, let alone saving all of the hospital resources from being overused. Remember that these slides, you may be thinking or comparing to slides you see on the governor's daily press conferences. These pictures I have here are hospital resources, and those are not what you see there, which is total number of cases. So what is like for me going to work nowadays? The first thing we do every day is we take our temperatures at the door. We see if we have a fever. We do that both on arrival and when we're leaving the hospital. 80% of the people that do show symptoms of COVID-19 have a fever, so this is the simplest screening test we could do. We are wearing our personal protective equipment all the time. It used to be that we would do that mainly when we were in high-risk situations, but now we have to assume that every situation is a high-risk situation. We need to protect our mouths and nose and eyes from any respiratory droplets. So we have several different face shields like the one you see here. I even have one that looks like a paintball mask. That one's probably my favorite, but probably the most scary looking. I wanted to stop for a moment just to talk about masks. What you see here in this picture is called an N95 mask. The hospital staff, the ICUs, the nurses, the ERs especially, this is the most important mask to us that we have to use all the time. It's a very tight-fitting mask that has to be fitted to our face. If it doesn't fit properly, it's not giving us the proper protection. And this is the one that's most important to us because it filters out over 95% of small airborne particles. Like we talked about, these particles that are in respiratory droplets. To not run out, we have to reuse these masks. We have to be very cautious with protecting them. People that are making us cloth masks have been awesome because what we're using those for is to protect our most important N95 mask. I call the cloth mask my PPE for my PPE. It protects my mask from getting soiled. So I wanted to thank people for doing that. There's been national companies that have decided to make masks for us. Hanes stopped making undergarments and started to make masks. But even locally, I want to give a shout out to Custom Apparel. They're a great company here locally that make a lot of your gear that's in the Hoban store, but now they're making face masks, especially for Children's Hospital. Also, what we're seeing in the hospitals that our patients are sick and then they're alone. We have to restrict visitors, and this is tremendously unfortunate. It's leading us to try and spend more time with our patients to give them support, but also putting ourselves more at risk. We're coming up with new ideas such as using iPads to talk to patients from outside the room and having iPads to use to talk to family that are at home. Yes, it's very difficult right now to wear all this equipment that we're not really used to. So we're changing how we end up being able to eat and drink at work. We're changing and limiting our intake because of our masks. We can't keep changing our personal protective equipment frequently because we don't want to run out of it. And how do I go home has been an important thing. I want to protect my family, so I cannot wear anything that I wear to the hospital into my house. A lot of my partners and I will have bins in our car of dirty scrubs or clean clothes. We'll have our hampers in our garage instead of being in the house. And then we take those clothes right to uh, hot water cycle on our washers, as well as we either take showers at work or we go straight into the shower when we arrive at home. You may have seen some triage tents and things set up outside our local emergency departments. Well, what are they for? Well, most of all, they're really for trying to screen patients. We want to keep some low acuity patients outside of the hospital. This will decrease the risk of not only exposing them to patients inside the hospital, but exposing healthcare providers to more patients they don't necessarily need exposed to. The other thing that this will do is it helps us get the patients to the right place. Say you presented to the hospital and really just need to go to radiology to get your ankle x-rayed because you're worried you broke your ankle. We want to take you somewhere that hasn't been exposed to a COVID-19 patient getting a chest x-ray. So that's why we're utilizing these resources literally outside our hospital doors to try and protect both patients and staff. Sometimes even in the ER, we have set up COVID-19 sections of the ER. We know that's our highest risk area. And so we're treating that as a hot zone and keeping other staff members out of that area. You may have also read that some hospitals have utilized these tents for drive-up testing. That's still been kind of a work in progress until we get more testing available to us. We are really working on many fronts to try and help get through this crisis. One of those is telemedicine. Telemedicine is almost similar to what you're doing right now. You can talk to a doctor on your computer instead of going into the doctor's office. Our telemedicine platform for our company has been seeing thousands of patients a day. You can answer questions, you can provide routine care, you can help those that are calling in on telemedicine to know when to go to the ER and when not to go to the ER. That minimizes any unnecessary contact for those patients into the hospital. We're also using something that I call mutual aid. We're getting people emergency credentials. We're sending other doctors and other nurses to various hotspots throughout the country where we know that there's a higher number of cases. There's been massive efforts, quicker than I've ever seen happen before, on the research front to find the most effective protocols for treatments and for developing a vaccine. There's several trials going on for various medicines. I know one that we're hearing a lot about is hydroxychloroquine. It's actually an anti-malaria medicine and then used in some rheumatologic diseases. But it has a lot of side effects. It has a lot of drug interactions, even some serious ones that can cause heart rhythm problems. So we have to be very cautious in our use of these. So that's why the research is still going on of what the most effective treatment is. I believe a vaccine is probably 9 to 18 months away. So it's not going to help us on this outbreak, but it will help us on future situations like this, so we won't have to go through something this severe again. I mentioned before that companies are really helping us by producing more personal protective equipment. We are then also trying to look at researching ways to reuse that equipment. So we've been constantly experimenting with how to disinfect and reuse PPE. We've used heat, we've used UV lights, and this helps us protect and make our N95s last longer. So what can you do? The most important thing I can tell you today is really to stick to good, proven sources of information. CDC.gov is probably the best resource. Your healthcare provider uses this resource. Your healthcare provider also is getting other resources from their specialty boards, such as internal medicine and infectious disease, as well as my specialty board in emergency medicine. And so they can answer the questions best of all. I would encourage you to take some breaks from social media. Realize that the social media information cannot be as complete or as a solid source as you may think it is. There's a lot of incompleteness or inconsistency out there on social media. One scary incident happened when social media in Iran actually said that alcohol could kill the virus. So then bootleggers started making alcohol, and people were drinking this alcohol, and then suddenly over 300 people died from bootleg alcohol that actually caused methanol poisoning. There's been case reports of people drinking fish cleaner because fish cleaner contained the chloroquine that you hear about that I just mentioned. We are researching its effectiveness. Well, fish cleaner contains that, but it's not the right thing to do to prevent COVID-19, and it actually has caused death from people taking that. Again, the most important thing is if you feel sick, stay at home and contact your doctor. Your doctor will help you know when to go to the ER and what to do at home. Another great screening tool is actually made by Apple. You can see their apple.com/COVID-19. It works on all platforms, not just on Apple devices, but it'll help you see if your symptoms are more worrisome to go to the ER or how to treat them at home. Again, continuing our social distancing. I know that this has been tough. I know that this is really creating some changes in our lives, but please stay at home. Not even allowing a group of friends over to your house. You don't realize that bringing someone over to your house not only puts you in contact with them, but actually puts you in contact with their parents or their parents' workplaces and anything that they could have been exposed to there. There was a great video just a few days ago put out by Ohio State School of Medicine. You can look it up by looking up ping pong balls. They dropped a ping pong ball onto things that were too close together and how that caused spread so fast. Then they dropped a ping pong ball on things that were spread apart, and that you can see did not cause spread. And it's just a great visual reminder of what we're trying to do here. Practice good hygiene, and what I mean by that is I think most of all it's hand hygiene. I am constantly grabbing my alcohol to wash my hands, or to washing my hands longer with soap and water. So wash your hands, cough into your elbows, and disinfect surfaces. We actually have something at the hospital where our ER secretary will play a song overhead every hour on the hour, and it's a reminder for us to, we're hear the music, we're supposed to stop and disinfect our work area. And most of all, don't touch your face. When you do go to the grocery store, spend the whole time in the grocery store without touching your face. And then when you come out of the grocery store, to wash your hands again with your alcohol. Now I wanted to see what your questions are. So again, if we wanted to use the chat button that's on Zoom, we will look to see some of your questions. Here's one I have initially about, again, how do I go to the grocery store? So the first thing I do is I wash my hands with my alcohol, my hand sanitizer. So then I don't touch my face at all while I'm in the store. I literally will act like I have coronavirus on my hands. That's the safest way to think about it. And then after I'm maintaining social distancing, getting through the line, going out to my car, I'll wash my hands again and immediately sanitize them again. Well, here's a question about hiking. Is hiking safe when you're 6 feet apart? Yes, it is. And I've actually had the similar question about going golfing. Being outside, getting the fresh air is something we all desperately need right now. So as long as you're practicing social distancing, walking apart from each other, it's a great way to get your exercise. Here's a question about we're going back to school. Oh boy, is that really a hard one. Also in the same question, when will this end? So most projections show that some states are at their peak right now, or that they're peaking within the next 1 to 3 weeks. But these are just projections. The truth is about social distancing is it's decreasing our number of people getting sick, but it's also spreading out the course of the disease a little bit longer. And the biggest concern is that if we open up too soon, will lead to a second peak of the disease. So I can't answer specifically, are we going back to school? I certainly hope so, especially for our seniors. But I also know that we'll have to be very cautious that from a healthcare standpoint, we cannot run the risk of getting increased exposures again. I do know that when we're better at social distancing now and slowing this curve, fewer people are getting sick. So here's a question about age group for between over the age of 60, I'll call it. So that is a higher risk population. Is it safe for the group over age 60 to go back to teaching, is what it sounds like is the question. Yes, it will be safe. I think that this has taught us that we have to change some of the things we've been doing in regards to increasing our amount of hand hygiene or using proper social distancing in the right situations. I think that even though someone's over the age of 60 and their risk of the disease making them sicker is a little higher, it doesn't change doing exactly what we've been doing. And it won't change that when we go back to things opening back up. We'll go back to being cautious, washing our hands more frequently after we touch objects and things like that, and that will help keep us safe. Let me see some of these chats here. Well, here's a great question about cloth face masks. As I mentioned before about N95s, I think those are really what's important to the healthcare provider. We are right up taking care of patients that are coughing, that are breathing heavier, that are expelling those respiratory droplets. Those N95s are most protective for the healthcare provider in that situation. I do believe that a cloth face mask is appropriate at the grocery store. I don't think that it necessarily has to be an N95. I understand that a higher risk population, such as someone that's older or someone that has lung disease, would feel more protective with an N95, and that's fine. But please understand the purpose of masks. In actuality, by wearing a mask, you are garnering some protection for yourself, but what you're really doing, more importantly, is especially the young people, especially the healthy people, you are protecting everyone else from in the situation where if you are not showing any signs or symptoms, but still carrying the disease, that you are protecting others. So wearing a cloth mask is appropriate for the grocery store, number one. And number two, realize that the wearing of that mask, you're protecting others just as much, if not more, than you're protecting yourself. A question about, will warmer weather kill the virus? I hope so. And I apologize that that's kind of a non-answer, but the truth is we are still researching that. We don't know that if this is a seasonal virus for sure or not. We suspect so, and we suspect as it gets warmer, then there'll be some seasonality to this. But when we talk about it being a seasonal virus, remember that it's something that we'll have to continue to deal with every year. So that's why some of these new practices will kind of be permanent for us. A question about likelihood of reinfection, or do you get antibodies after you get it? Well, that's a great question as well. There's actually a huge amount of research going on right now for that exact problem. People that do get infected do develop antibodies. The whole key to this is not only knowing that they develop antibodies, but doing tests on those antibodies that'll help us, number one, develop a vaccine for COVID-19. But also number two, there's been a lot of research going on right now about plasma from people that have survived COVID-19 and using that plasma as a treatment for the very ill patients with COVID-19. The other thing that analyzing these antibodies develop for us is learning more about something called, quote, herd immunity. That essentially means that when enough people have had the disease dies out because it doesn't have any further people to infect. And we need to study these antibodies to learn if we reach a point where essentially 50 to 65% of people have this disease, that'll develop enough herd immunity that we won't be seeing this disease anymore. Herd immunity is the same thing we'd see if everyone got immunized for the disease. Someone's asking about their surgery scheduled for June 18th. Will it happen? I think by June, we will be having more elective procedures, but again, it's all about avoiding a second peak. Is it safe to buy food at a drive-through? Absolutely. I think, again, you're talking about touching surfaces like bags and boxes of food, et cetera, et cetera. And what I do in the same vein is I, just like my groceries, pick that up with my hands, don't touch my face, wash my hands with my alcohol gel or wipes after I bring that home, but it is safe to buy that food. Question, aren't we all going to get it eventually? Again, that goes back to people that can be asymptomatic and have this disease and then be carriers or developing herd immunity. Long story about that is you don't have to have everyone to have the disease to develop that immunity. So no, we're not all going to get it eventually, but again, we will all develop antibodies if we do get this disease. When and how will the virus end? Well, we talked a little bit about that. It's multifactorial. It'll end as we develop more people with immunity. We will end hopefully as it gets warmer, if it is a true seasonal disease. And yes, it'll end when we develop a vaccine, but unfortunately, sometimes for vaccines, that takes about a year away. Should I wash my clothes after grocery shopping? Again, let me emphasize, the people like me that are at highest risk are when I'm within 6 feet of an actively coughing, sneezing, breathing hard patient, and then that has the chance for the virus to be on my scrubs or on my stethoscope. Those are the type of things that I need to wash extensively or sanitize extensively before I bring that into my house. You're not at risk going to the grocery store, standing 6 feet away from somebody, of getting virus on your clothes. So you're not at risk for needing to immediately wash your clothes when you come home from grocery shopping. Here's a question for those that have self-isolated for presumed disease. One, is it safe to be with family members? All of our studies tell us that the course of this disease, you're most infectious about day 5 to day 12 or 13. That's why we're using the number of quarantine for 14 days as getting through that period. So if I were to come down with this disease, I would quarantine myself at home in my own room that my family wouldn't be in for 2 weeks. And when I came out of that room, I would have a mask on to protect my family. And those are the type of things that we do if we isolate at home. Question, if we return to school where we have to wear masks, will it be mandated? I don't know. May it be an acceptable idea? Yes, I'm going to defer that one later to Dr. Curry and his team. When will antibody testing be available in our area? I know that we're testing our inpatients at SUMA. I know that they're doing some more inpatient and outpatient through Cleveland Clinic and UH. I know we're striving the goals of the healthcare community to have the ability for anybody to get a test. They need to develop finger stick tests. They need to develop quicker ways to perform these tests in our laboratories. So those are all being researched, but I don't have a timeline of when they'll be available. If we have a vaccine, how will we distribute it to everyone? I suspect it'll be very similar to how we do our flu vaccines every year. It can be distributed at pharmacies, hospitals, doctors' offices. And I do anticipate that that'll be a vaccine that we have available to all of us by next year. Are there different strains of COVID-19? To be specific, there's different strains of coronavirus. And COVID-19 is the 2019 strain of coronavirus, similar to a 2003 strain and 2012 strain that caused pandemics. There are multiple other strains of coronavirus that just cause common colds. Those have not really developed anything more than a common cold, so we've actually been seeing those for years, often with a seasonal component, just like we see the flu. Here's a question. I'm a home visitor. When I return to work and start visiting again in the home, should I continue to wear a mask and gloves? I currently have been quarantined. If you're currently quarantined, then yes, you should be wearing a mask and gloves. Remember that a mask is protecting others from you, even more so than it's protecting you from other people. When you visit homes, when you return to work, you're probably not contagious after the 14-day quarantine. Is it safer for you to protect others? Absolutely, that you should wear a mask. Here's a question. If you recover from COVID-19, will you need to get vaccines in the future? Well, let's talk about vaccines for a second. Again, we don't know the answers yet because our research is still going on, but a flu vaccine is essentially made from the previous season's flu virus. So we take the DNA from the previous flu virus and develop that vaccine. We will do the same with a COVID-19 vaccine, but will we have to get it every year in the future is yet to be determined, because we don't know how much this virus is seasonal, how much this virus will change its DNA, and those are the type of things that lead to different vaccines. So if you have COVID-19 and will you need the vaccine next year or not? I don't know what the recommendation will be as for that. I assume it'll still be recommended that you get the vaccine next year. I think as far as I can tell, according to the group chat, I'm caught up on questions. Unless I missed one, could you please re-enter that question? Are there issues with accuracy of the serology tests, such as in false negatives? Yes, every test has false negatives. The tests that we're doing in the hospital are the tests that have found to have the lowest rate of false negatives. As we develop more and more tests, they will have to be screened for what their percentage of false negatives are. But every test we do has a false negative. Question. We have a family member requiring home health aides. Any thoughts on when we might be able to have them back into our house if we've had them out of our house? If the home health aides are following safe practices, it's safe to have them in your house. If the home health aides are wearing their masks properly, it's safe to have in your house. How do you disinfect a cloth mask at home that has a plastic vent and can't go in a washing machine? Boy, that's a difficult one. You need to take if there's ability to take the cloth mask apart from the plastic vent, then the plastic vent can be wiped down with alcohol wipes. That's essentially what we're doing at the hospital with our face shields. But yes, we're putting our cloth masks in the washing machine. I would not use a mask that has both a cloth mask and a plastic vent for this reason, because you can't heat it or place it in something hot or the plastic will melt. For people over 60 that are a mandatory worker, what kind of accommodations do they have to have? I'm wondering what you mean by accommodations, but really the accommodations are really just a masks to help protect others and to help protect yourself. The second thing is really what we're doing. I don't think you need to have a box of gloves and have that on for everything you touch. I think you just have to realize that after you touch something, the hand washing and the use of the alcohol gel is really your most important friend there. In my opinion, do we have a cure for COVID-19? To be specific, coronavirus being caused by a virus, antibiotics do not help viruses, do not kill viruses. But thinking of a cure in regards to management options, absolutely. We will find the right combination of medications that decrease the virus's replication and limit the disease. We know that the virus itself is encapsulated in a fatty protective layer, if you will, and breaking down that fatty layer is really what is the detriment to the virus. So we will come up with management options. I'll use that word instead of using the word cure. A question about checking on an elderly relative out of town. Interact safely, just as you would that we're talking about somebody here, with your mask on, with frequent hand washing, 6 feet apart, that type of thing. How to isolate on return, that is a concern. If you're traveling by plane, you have a higher risk of being exposed. If you're traveling to a hot zone area, you certainly have a higher risk of being exposed. And what you do on return here to Ohio, the recommendation is the 2 weeks of self-quarantine. Question, can animals spread or catch COVID-19? There has been 0 case reports in the entire country of any pet catching COVID-19 from a human. In regards to the animal spread question, you've probably read something out there that this first spread in China from bats. I wanted to be really specific on that. Multiple coronaviruses, the Middle East respiratory syndrome, started with as an animal disease, and for reasons unbeknownst to us, the virus actually changed its RNA or DNA and was transmitted to humans. The MERS coronavirus initially was in camels, if I'm not mistaken, and there was a thought that this coronavirus is initially in bats. Did they spread it? We honestly don't know. There were some reports that it began in a outdoor market in China, but that really was never confirmed based on the other spread that happened in China. You might have read about, there is a zoo animal here in this country that was tested positive. I don't know what made them test that animal. I don't know. But again, I do know that there's been 0 spread to any at-home pets. Question, if this is airborne, we're having better ventilation in offices or schools help? Yes, there's been some studies done that, and I'm blanking on the exact terminology, but the term of how many times per hour you change your airflow, and in rooms that their airflow is changed only once or twice an hour, as a higher propensity to keep the virus in the air. But rooms that change 10 times per hour, the virus is dissipated. So yes, having better ventilation in offices and schools does help. Is there ways to prevent or be prepared for outbreaks like this in the future? I don't know that we can prevent every possible thing in the future. Yes, we can be much better prepared, both as healthcare systems with enough equipment. And I do anticipate that it'll change our healthcare system because of it, because we will have more stockpile, if you will. We also will change the process of a few things in the hospitals to limit the risk of our healthcare providers. Can this survive on student work papers? No, it cannot. There was some early thoughts that the virus can survive on cardboard and things like that. Those studies were never really borne out to be truthful. And the bottom line with that is, if there is any virus on cardboard or papers or boxes, it's not in a high enough quantity to cause disease. If your immune system is compromised, will the vaccine be effective? Yes. As far as my understanding of the plans for the vaccine, again, until it's fully developed, we won't know for absolute sure. Do you think that many people have already had COVID-19 in the past couple of months, but we didn't really know exactly what it was? Yes and no. Let me be very specific about that. I do not believe this disease was in this country back in October, November, December. I do believe it was in this country in late January and then February and March. At that time, we were seeing people with similar symptoms that we were testing for flu and all the complications related to influenza. So did we really not know what it was? Maybe, because it's similar in its respiratory symptoms like influenza. But no, I don't think it was any farther back into last fall. I think I'm at a spot where I'm caught up again, unless anyone adds any more questions. I'll wait just about 1 or 2 more minutes if anyone comes up with any other questions. Again, thank you so much for everyone for listening to this, and I hope it helped. Please contact your primary care physicians. If any other questions that I didn't go over, please use cdc.gov. It's a fantastic website for answering a lot of these questions. I hope to see everyone again very soon at Hoban at athletic events, and I would be more than happy to take your questions then as well. And again, thank you everyone so much for your time.